a bone cancer diagnosis raises hard questions. Surgery is usually the central step, planned by a specialist team. Bone cancer surgery removes the tumor along with a rim of healthy tissue, leaving what surgeons call a clear margin. The operation has two parts. First, resection removes the tumor. Then, reconstruction rebuilds the bone so the limb works again. Most common bone sarcomas include osteosarcoma, Ewing sarcoma, and chondrosarcoma. Surgery may also treat cancer that spread to bone. A tumor board of specialists reviews scans, biopsy, and general health together. This planning shapes how safe and effective surgery will be. For osteosarcoma and Ewing sarcoma, chemotherapy is usually given before surgery to shrink the tumor and improve outcomes. Limb-salvage surgery removes the tumor while keeping the arm or leg. Today, it's possible for most patients with extremity bone sarcomas. Reconstruction uses metal implants, donor bone, the patient's own bone, or a combination, chosen to fit the tumor's location. Amputation is chosen less often today, but remains the right choice when nerves and vessels can't be safely spared. Surgery is done under general anesthesia and can take 4 to 8 hours or more, depending on the site. Early movement begins within a day or two. Physiotherapy protects the reconstruction, then rebuilds strength and walking over months. Risks include infection, blood clots, nerve injury, and later implant wear. Specialist centers report lower complication rates. Structured follow-up continues for years. Visits, scans, and chest imaging watch for recurrence and monitor the reconstruction. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.